Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton, and I'm delighted today to be joined by Mr. John Hoglund with Hoglund Family Hearing. How are you?
Very good. And how are you doing through this pandemic?
I am hanging in there. Definitely trying my best. I think we all are.
Yes, indeed.
Yes, indeed. Well, it's good to see your face. It's been a long time, so I'm excited to have you on the show today. Just talk to me about some of the changes in the world of hearing that are happening during this pandemic and affecting our seniors.
Well, the biggest single thing is everything that has to do with their medical. Anytime they go to a doctor's office, or God forbid they get hospitalized, they now have to go alone. So what has changed dramatically in the world of hearing is this being over people's faces. Now, as you can see, the volume doesn't drop dramatically when you cover it, but what happens is you lose visual clues. And so many people count on visual clues. And now when you get into a hospital, they have the N95 masks that actually cut the volume 10 decibels or more. So that has been really traumatic. And so our outreach has been to be sure that everybody's hearing aids are working right now. So we have set up a lot of new social distancing guidelines, but the biggest thing is we are doing free warranty repairs for any manufacturers. Some really nice clinicians, good clinicians in the area, they have family at home, so they're home. They have somebody who's at high risk, so they've closed their doors until things get better, and people have nowhere to turn. So our people that were trapped here because of not being able to go north and their clinician is up north. So we're taking on and doing all of these as our help for the hearing impaired, because I can't stand the idea of somebody being there and not being able to communicate. And what happens is with people with masks, they have to raise their voice for every communication, and people raising their voice seem like they're angry with us. So these people can be shouted at all times. It just makes an already unsettling situation that much worse and that much more stressful. So we've actually set up for anybody a pandemic hotline. And if people call our office in the 239 area code, 360-3753, we can make arrangements at any of our Southwest Florida clinics, and people, even if they're quarantined, if they can't get out, if a family member can bring their hearing aids in a Ziploc bag with their name and phone number so we don't get things confused, we'll come out with our gloves and masks, pick them up from the parking lot so that nobody in the at-risk population has to have a personal interaction to get their hearing aids working. And again, there's no charge for any of this.
So you mentioned something that we should probably address, like your office is open, you guys are open for business. What can someone expect? What protocols and procedures can they expect when they come to visit your center?
Well, we have to be especially careful because all of our clientele are in the at-risk group. So we don't have anyone in the lobby anymore. When people come in, there is a curbside check-in. So I tell people when you get to the parking lot, call, let us know you're there. And because of not knowing how long some of these appointments will take, etc., bring a cold drink, bring a little something to read, just relax, and we'll get you in as soon as we are. And when you see someone walk out the door, that doesn't mean it's time to come in, because we're doing a full sanitation between every patient. You know, anybody who touches a pen keeps the pen. If you have to fill out paperwork, the clipboards are sterilized every single time. We're cleaning every office between. We're using masks and gloves ourselves. We appreciate using masks. We'll have a questionnaire and a screening procedure. We just received the ability to test people's temperature as they walk in. So the people who are coming behind you, if you are sick, use our curbside. Have somebody get it to us. We'll still get your hearing aids fixed without an interaction. And there are other things that have gone on that have allowed us to find different alternatives if people physically can't even get the hearing aids here.
All right, perfect. Sorry about that. Now, in the field of audiology as a whole, what type of changes have you seen since this pandemic started, and what do you see for the future?
Well, it has been fascinating. For a while, they have been working on being able to do telemedicine within our field. So some of our crew has adapted a FaceTime for hearing type of telemedicine approach. So everybody's getting more used to, if they want to talk with their family or their grandchildren because they can't get in, they'll use a FaceTime type thing. Well, we have the same app where we send them a link, they click on it, now they can see us and we can see them. So if they've forgotten how to do things with their hearing aids, we can do it for them, like somebody changing a wax guard or changing different things. I've listened through the doors and I've heard our staff members talking them through it, and they'll get through some of the basics, some of the fundamentals. But now, one of the manufacturers in particular, this Starkey Laboratories, on their very, very expensive, very high-end new product, they had a way for us to set up a code. We had to do things in the office. And then if they, let's say, went north, we could adjust their hearing aids from Florida while they were up north. Well, they hired a brilliant man by the name of Achkin Bomick, who was well connected with Apple and with Google. And during the pandemic, they have found a way for us to adjust any of the newer Starkey hearing aids, even if they weren't our patients, even if they haven't been in our office. We send a code and then they're describing what they need done. We can work on our laptops and we can send the corrections to them and fix them. Now, it sounds complicated, but I have a secret weapon. We have millennials. Really good, knowledgeable millennials.
I love it.
Dr. Richter, Dr. Newfer, Derek Wynn, Chris, our daughter Avery,
Yeah.
and I listen to them
I was just going to
calmly.
bring that. I was just going to bring Avery up into that. So yeah, absolutely. That's awesome.
Well, and they're fabulous. So I'm listening through the door and just do this. Now tell me what you need here. And then we're making the tweaks. They're listening to them in real time and they're able to keep people, because some of the retirement facilities really don't want people going out and certainly bringing it back in. So, but all the manufacturers have something we can do. This Starkey one just happened to be amazing. And so they're the number one in the United States and probably in Southwest Florida.
And it's
So, but if they,
amazing what technology has done and what we have really shown during this pandemic, what can be done virtually. It's amazing, isn't it?
it really is. And we've gotten into virtually coaching people and working with people that have other ailments like the tinnitus population. And we've really been able to do things that have helped others in ways I never dreamed possible.
Now you hit the one of my hot buttons because my dad suffers from tinnitus, and I truly believe I do as well. Um, Talk to me about how this pandemic has affected those patients of yours specifically with tinnitus.
It has been devastating. So stress, the stress hormone called cortisol, is like kerosene on a fire to tinnitus. So tinnitus people need to stay busy, they need to stay distracted, and now they're quarantined, trapped at home. They're worrying about their careers, they're worrying about their loved ones, they're worrying about their health, they're worrying about food supply. And all of these things just contribute to stress. And people that their tinnitus was under control for a very long period of time have been calling in. The American Tinnitus Association has a hotline for tinnitus patients. They have had to add so much staff to handle the hotline because on a nationwide basis, it's a big deal. So if people reach out to me, and that would also be on the pandemic hotline, if they reach out to me, I can do this type of thing over the phone, perhaps. I can talk to them over the phone. There is a lady who has an excellent program called Mindfulness for Tinnitus that handles the stress aspect of it extremely well. And it usually costs $400 to take this course. She's waiving the fees, and mindfulness helps. Anything you can do to reduce stress, anything you can do to lower your anxiety level, because there's three legs of this tinnitus stool: the sound itself, how much that sound draws our attention, and then how much stress or distress that brings to our life. And it's a vicious circle. The tinnitus fuels the stress fuels the tinnitus, and it can really get out of control. And we are a resource. Our Southwest Florida Tinnitus and Hearing Center opened 8 years ago, so we've been embedded in the tinnitus community for a long time, and we'll help anybody that we can.
That's amazing. Thank you for going through that. I think it's so important that people know that there's a resource to reach out to for that, because they don't a lot of times not even understand what's happening to them. I think they're going crazy,
Yes.
right?
Yeah, exactly.
Now, I know social isolation has affected not just our elderly population, but more so them than ever. Talk about how this particular situation really is affecting our seniors.
Well, there's so many people that downplay their hearing loss. It's no big deal. If it's important, people will repeat it. If you don't like how loud I have the TV, watch it in your room. Well, now people are on top of one another. And you really need to have a situation where you can hear and understand people. And we are trying to help everybody. If people have gotten away from using their hearing aids, we want to get them fixed for them. But it's funny. I've been talking with some old friends, and I talked with an old mentor of mine. And many years ago, when I was young and impressionable, in my 20s, he had written a poem called Silence is Lonely. And I've been reading it recently, and I pulled it back out, and I just want to share it with you. But it covers psychologically, if you have a health condition, address the health condition. So many times it's one we try to avoid, one we try to not face. But I think you'll find this is cute. When at first our hearing begins to fade, though the signs are foretelling, we choose to evade. We tell others they don't speak clearly, they mumble a lot. My concentration is elsewhere. That's why I ask, what? Please talk a bit louder, your voice is so weak. I could hear you okay if you would look at me as you speak. I can hear you just fine when you're close at hand. If you would learn to enunciate, I could understand. Being with family is one of life's greatest joys, but don't expect me to hear with all of that noise. It's easy to blame others, though it's not really fair. It's your hearing problem. Solve it. Show others you care. He who said silence is lonely, or silence is golden, spoke for himself only. For the hearing impaired, silence is lonely. And all of the research continually shows untreated hearing loss can lead to depression, can lead to memory problems, can lead to increased risk of falls. And there are so many negative consequences of ignoring one of your five senses. So the beauty of this pandemic is we have time now. So we can teach people about their hearing. We can help them understand what's going on. The manufacturers have stepped up with pandemic stimulus discounts that are really good. I've gone through a lot of things over my career. We certainly have gone through Hurricane Irma. We've gone through Hurricane Charlie. We've gone through the economic crisis of '08. We've gone through 9/11. And through all of these, the manufacturers step up and they do things to help people who are the most impacted, which is our seniors on fixed income. So fortunately, there's pricing better than I've ever gotten, but the biggest thing is knowing where you stand. And so people have time on your hand. If you're one of the healthier ones, you will be the only one in the office with you and the clinician. sanitized to CDC standards. We will check and find out what's going on. If you have wax in your ears, we will attempt to clean it for you. Sometimes people haven't gotten in to see their specialist and they just need some wax removal and their hearing aids will work better. But even if it's just a curbside drop, you know, I know a lot of people who are in the retirement facility business watch your FaceTime Live. If you're part of a group, if you can get one driver to bring people in your centers hearing aids to us, we'll fix them all and call them when they're done. You know, we'll get through this. Southwest Florida has been through a lot, and this too shall pass. But, you know, we will do everything we can for the hearing impaired when they need us most right now.
That's so fantastic. Thank you, John. I really appreciate what you're doing for the community, and I appreciate you coming on the show today.
Thank you. And those of you out there, if you're not using your senior blue book to find all of the available resources to you in times of crisis, you should have gotten your copy. There's still time. Go to, next time you have to go pick up medications, they're in most of the drugstores, but Senior Blue Book helps a lot. And I've really appreciated watching all of your other guests. And thank you for getting the word out, since we can't go to the communities like we typically do.
Yeah, absolutely. It's my pleasure. I really appreciate your kind words and your support, John. Thank you so much.
And thank you as well. Southwest Florida strong. We will get through this.
Yes, sir. Have a great day.